I'd like to present my report on the topic Zinaida Yermolyeva'S contribution to the development of domestic microbiology. The development of antimicrobial agents was the top priority of scientists in the 12th century. One of the founders of Russian microbiology, Zinaida Yermolyeva, didn't choose her profession by accident. She decided to become a doctor after learning that her favorite composer Pyotr Tchaikovsky had died of cholera. Zinaida decided to devote her life to fighting the disease, and she became a student of the medical faculty of the Donskoy University in 1915. A cholera epidemic swept through Rostov-on-Don in 1922. Investigating the nature of the infection, Yermolyeva conducted a dangerous experiment. She drank a liquid with bacteria isolated from tap water, similar in properties to cholera. After 18 hours, Zinaida fell ill, but the young body coped. And as a result of the experiment, Yermolyeva was able to identify pathogenic bacteria that can be used as a vaccine, and also suggested chlorination drinking water. She moved to Moscow in 1925, where she continued her research within the walls of the Biochemical Institute. In 1939, with a group of medical scientists, she tried to stop the spread of cholera in Afghanistan, where she invented a high-efficiency drug. Zinaida Yermolyeva returned home having become a professor. In the midst of the Great Patriotic War, Yermolyeva established the production of cholera bacteriophage in Stalingrad. The vaccine was given to 50,000 people daily, and the disease subsided. Observing the wounded soldiers, the microbiologist understood that they were dying not from wounds received in battle, but from blood poisoning. Zinaida Yermolyeva, with a team of scientists, began creating a first domestic antibiotic in 1942. A few months later, from a mold scraped off the walls of bomb shelters near Moscow, a drug similar to penicillin was obtained named crustazine. The first clinical trials were conducted on seriously wounded soldiers, and the results exceeded all expectations. The results was amazing. Hopeless patients survived, and not a single leg amputated, Yermolyeva recalled. Soon the production of an antibiotic was launched, which cured hundreds of thousands of Soviet soldiers. The creator of penicillin, Howard Florey, who visited the UCCR with a delegation in 1944, compared the two antibiotics. It turned out that crustazine was not only no worse than penicillin, but actually more effective. Florey was so impressed that he nicknamed Yermolyeva Madam Penicillin. Yermolyeva became a full academician of the UCCR Academy of Medical Sciences, and she was named an honorary scientific worker of the Russian Soviet Federation Socialist Republic in 1970. During this phase of her career, Yermolyeva conducted important research on streptomycin and developed other important antibiotics agents such as interferon, bicillins, and ecmalin. Yermolyeva's life, as well as the history of her research activities, aren't well reflected in scientific literature. Unfortunately, no historiographical work has been published on the history of these amazing women scientists. Zinaida Yermolyeva passed away on the 2nd of December in 1974, having managed to hold her last scientific conference on that day. Thank you for the attention.